Well, good afternoon once again. Thanks for joining us for today's Daily Update. My name's Dougal Saunders, joined by Scott McLaughlin, Chief Executive of the Western New South Wales Local Health District, and also Assistant Commissioner Jeff McKechnie, Commander of the Western Region. And I want to start today with another little ray of sunshine. It's certainly freezing across the region, but the little ray of sunshine today, which you may have heard around, is that as of now, midday, there is a children's bubble and teenager bubble that is in operation to try and help parents and children, create their own little bubble to help with a couple of things. One will be for students that are studying for the HSC. So this is for children 18 years and under, but also to help parents that have had kids that are pretty bored, school holiday time now, to look at opportunities to let them actually catch up with friends that they haven't been able to catch up with up until this point. Now look, there are a couple of things. The adults in both homes, as in the home for you if you're the parent sending one of your children to somebody else's house, but also the house they're going to, all adults need to be double vaccinated. So again, a bit of an incentive there to make sure that you are double vaccinated and your friend circle are doing the same thing. So each child is allowed to have 2 designated friends that come to the house. So essentially, those 2 friends must always be the friends. So that creates a little 3-person bubble in that group. Anyone older than 18 does have to be double vaccinated. The friends need to reside within the same local government area, or if you're just near a border of a local government area, it's that 5K scenario again. And parents or carers that are dropping children off need to keep their distance and not actually go and then catch up with the other adults in the house. So more details sort of across the day, but that detail is up on this Facebook post right now. And again, a way of encouraging a little bit of normality for our young people who have been doing it pretty tough, haven't they, up until this point. I'll run through some vax rates today as well, but look, in general, we've got some extraordinarily good results in first doses and still a bit of work to do on second doses. And I'm sure Scott will talk a bit more about this as well. But just quickly, Bathurst Regional Council first doses around 83%. For Blaney, it's around 88%. Cabonne, 85%. Dubbo, around 89%. Forbes, 87%. Gilgandra, nearly 93% first dose. Midwestern, 87% for around the Mudgee area. Narromine and Orange, both around 90%. Parkes, around 85%. Warren, around 90%. And Warren-Bungleshire about 84%. But we look at second doses and there's still a bit more to do. And obviously the ADF clinics being back in our region again at the moment will help that. But there are still plenty of other ways to get your vaccine, including GPs and pharmacists. 46% for Bathurst Regional, Blaney about 49%, Cabonne 48%, Dubbo Regional 55%, 56%, nearly 57% for Forbes and also for Gilgandra. Midwestern Regional about 40%. Just over 52 for Narromine, 52 for Orange, 52 for Parkes. Warren 63%, which is incredibly good, and Warren-Bungleshire about 43%. So when you average that out, and Scott might talk about this a little bit more, we do have some work to do for our second doses. So we're really pushing vaccination is really important to get the second dose in your arm. Now, up until 8 o'clock last night, we had 7 new cases of COVID-19 across the Western New South Wales Local Health District, 4 in Dubbo, 1 at Mudgee, 1 at Walgett and 1 at Cowra. As I mentioned yesterday, Cowra is now back at stay-at-home orders. That applies to anyone that was in Cowra from Monday of last week, the 13th of September, no matter where you are now. That stay-at-home order does apply. The Health District total now, cumulative 1,080 cases in total. Dubbo 771 in total. Far West today, Wilcannia 5 new cases, Broken Hill 1 new case. Now, from that 7 cases we've got today, 3 infectious in the community, 2 of those for more than 2 days. And Scott will talk a bit more about these cases, both Mudgee and also Cowra. 2 are isolating, 2 still being investigated. Just over 230 people now in that COVID care in the community program, 37 extra discharged in the last 24 hours, and the total is almost 800 now that have been through that program, which is extraordinarily successful. Almost 3,000 tests across the district yesterday, and about 930 of those in Dubbo. And the big news today, and again Scott can allude a bit more to this, is surveillance testing, which we talked about in the last few days, expanding it to lots of areas across the region. From now, essentially, we're saying the entire health district is able to take part in surveillance testing. So again, just to clarify, surveillance testing means you can test yourself once or twice a week to try and stay ahead of the game. Now, if you do not have any symptoms, if you are not living with somebody that has symptoms, if you're not a close or a casual contact for a positive case, you can do that test and continue on with work. You don't need to isolate unless you have concerns or unless you have symptoms. So it's a way of, as I say, staying ahead of the game, keeping our numbers ticking along so that we do pick up the occasional case where people are asymptomatic, not showing those symptoms, but it's a great way of making sure that the testing we need to keep ahead of it continues. So do that now. You can do it anywhere across the district, particularly where there's sewage detection or there's concerns around the community. Go and get yourself a test, and you don't need to isolate unless you actually need to. Vaccination second dose clinics at Nyngan underway today for 3 days at the showground there. Grenfell's happening today also at the showground. Lightning Ridge and Canowindra starting tomorrow. Mudgee running through until Friday at St Matt's, and Golgong until tomorrow at the Memorial Hall. And these are really important second dose clinics to make sure you are turning up. If you had your first dose with the ADF clinic, they have you locked and loaded for your second dose. If you haven't got a text, make sure you're turning up on the day that corresponds with when you got your first dose. West Haven Clinic, as I mentioned yesterday, in conjunction with Aspen Medical, that clinic is a walk-in clinic now for vaccinations. It's a Pfizer clinic, and it's open right now through till 4:30 every day, Hawthorn Street. You don't need to book, you can just turn up, and that is for everyone. So really want to see anyone who's missed out on a first or a second dose. That's a great place to go, and lots of other opportunities to book your vaccination through GP clinics, which are taking lots of non-clients at the moment, and also pharmacists all gearing up pretty much across the region for more AstraZeneca, but also in the next week or so for Moderna doses. So make sure you're getting involved with that. Before I bring Scott forward, just to assure you, there are on a weekly basis, local government areas that are being looked at to come out from stay-at-home orders. So there's been a lot of talk around what might that look like in this coming week. I can tell you that those decisions will be made tomorrow, and there are several local government areas across the district that are being looked at to come out, and I would expect some fairly positive news for many of those in the next day. That would include Gilgandra, Narromine, Orange, and also Brewarrina that are on that list that will be decided tomorrow, and I guess in that way, there would be an expectation, unless something happens in the next 24 hours, that they may well be a good chance of coming out from stay-at-home orders. So we'll keep you posted with all that information as soon as we have it to hand, and I'll ask Scott to come forward now with his update.
Great, thanks, Dougal. Afternoon, everybody. Well, some positive steps for us. We're very keen to see testing expanded right across the region, with the surveillance testing opened up for the whole of Western New South Wales local health districts. Every town across the region has the ability to get tested. If you don't have symptoms, and no one has symptoms in your household, you don't have to isolate. So can I please encourage you to think about the opportunity that you've got to get tested on a regular basis. Make sure you can keep yourself and your family and loved ones safe through this. Now, this is a step we'll take from tomorrow morning, so please, right across the whole of the region, whether you're in Orange, Bathurst, Dubbo, Burt, Brewarrina, Walgett, or any of other parts of the region, please come forward and get tested on a regular basis. It's our best tool in knowing where COVID is creeping around our region. We have seen a significant uptake in the last couple of days of testing, particularly in Cowra, prior to when we knew we had a case with the surveillance testing and people wanting to get tested. Nearly 1,900 people, or above 20% of the community, have come forward to get tested. So thank you to everyone in Cowra that have come forward to get tested. Vaccination rates continue to rise significantly in the region, as Dougal said, over 80% for the vast majority of the region. Some of our locations getting up towards 90% for first dose vaccination rates. We've, however, got a significant way to go to get to second dose, 70 and 80% targets that we know are going to be crucial in considering some of the changes to restrictions, but also protection for some of our most vulnerable and important people in our community to protect. So with that, there's a significant opportunity in coming weeks for us to all get a second dose. Please look out for those. If you've had your first dose already of Pfizer, the time frame is 3 weeks to follow up with your second dose. If it's been AstraZeneca, the time frame is somewhere between 4 and 6 weeks is the recommended time frame for our region. And so please, if you've had your first dose, look out for those opportunities. The ADF clinics and vaccination hubs through the local health district will be messaging you and contacting you to book in for those second doses. But if you've had them in other locations, then please don't hesitate, book in for your second dose, and let's get to that 70 and 80% mark as a priority. So with some lower numbers of cases in the region at the moment, there's some reason to be reassured. But we do want to make sure that we can stop COVID spreading around our community, and so both the testing and vaccinations are going to be crucial in that, the two things that are going to help us. So 7 new cases to 8 p.m. yesterday across those locations, 4 in Dubbo, 1 in Walgett, 1 in Mudgee and 1 in Cowra. In Dubbo, all of those 4 were linked and all household contacts, and so some pleasing signs in Dubbo, particularly with some of the increased testing numbers over the weekend, that there's a sense that we might be seeing a slowing of the community transmission. Coming days will be crucial, so please, if you've got any signs and symptoms, come forward and get tested. Don't leave the house without getting tested if you do have any signs and symptoms. In Walgett, another case that hasn't been able to be linked to any of the other cases in that community and has been infectious in the community. Likewise, Mudgee, another case that hasn't been linked to any other cases in Mudgee and has been very infectious in the community. And so both locations, please come and get tested if you've got any signs and symptoms, but don't hesitate, come and get tested even if you don't have any signs and symptoms. And a further case in Cowra that we believe is linked to a cluster around the school in Cowra. This is a parent of another student that attends that school, and so please, if you're in Cowra, continue to come and get tested at the same rates that have been happening. Out of the total 7 cases, 4 have definitely been linked, 3 are still under investigation, and a lot of following up to try and make sure that we've got those links. And again, 3 definitely have been infectious in the community across Walgett, Mudgee and Cowra. The locations of real concern for us across the 3 aged care facilities, we haven't seen any new cases being identified in the last 24 and 48 hours, and so some reassuring signs there. Those residents and staff are continuing to be tested every 2 days, and so we'll continue to do that and put all of the support and protection that we can around those aged care facilities. In the venues of concern, another venue of concern added overnight to Dubbo. Please, in Dubbo, if you can look at the New South Wales Health website and look at that details. If you have been in that location, please come and get tested, follow all of the advice. No new sewage tests in locations where we don't have cases. We took a lot of sewage tests yesterday. We expect to see them come back overnight tonight, and so that'll be another part of our surveillance and figuring out where we might have some risk around the region. Around 3,000 tests were done yesterday, so that's a pleasing number. We would still love to see that double. So the challenge for us with surveillance testing around the whole of the region is to double the rate of testing and for people to consider being tested on a regular basis. So if you've been tested in the last couple of days, and particularly if you've got signs and symptoms come up, then please come and get tested immediately. Don't leave the house without getting tested. But even if you don't have symptoms, think about coming on a regular basis to get tested. It'll be our best arsenal in helping to figure out how we best protect all of our community, yourselves, your mum, dad, and loved ones around you. The mobile at-home testing continues to be available across Dubbo, Orange, Bathurst, but also expanded now to Cowra. And so for people in Cowra that have some transport difficulties, can't leave the home for a range of reasons, then please call our 1300 066 055 call centre for access to that in-home testing. We've seen a further decrease in the number of patients being cared for through our specialist in-home care in the community program, down to 234, with 37 discharged in the last 24 hours. So some very pleasing signs of more people that are no longer infectious or impacted by COVID virus. A decrease again in the number of patients in hospital, so 14 patients in hospital. However, 5 of those are in intensive care and 4 of those are ventilated, and so some pretty crooked people in hospital. Out of the 14, 7 are in Dubbo, 6 in Bathurst and 1 in Orange. A further return of some healthcare workers to the workforce, with only 6 staff in isolation now, and a very pleasing sign with that. I just wanted to return to vaccination for a second. It really is going to be our solution out of some of the lockdown challenges and to keep our community safe. With a much lower rate than the rest of the state on average of second doses, we've got some challenges to catch up. We've had a significant benefit of the ADF clinics, of increases to the GPs, the Aboriginal Medical Services, the respiratory clinics, and now pharmacies able to vaccinate with more people. And so the next couple of weeks is going to be crucial for us. So again, if you've had your first dose, book in for your second dose. Look for those opportunities. If you haven't had your first dose, there's a lot of pharmacies in the next week that have got Moderna coming in. Now, it's one of the world-class vaccines that's now been opened up across Australia. I think over 2,000 pharmacies across the country will start to see Moderna coming in late this week and early next week. And so please look for that information in your local community. If you haven't had your first dose, then please consider that. It'll be available for everyone aged over 12. So the challenge is there in front of us to catch up with the second doses and to get to the 80% double dosed within the next month. Now, I'm sure that we can do that. It'll be the opportunity for everyone to protect all of our community, your loved ones and everyone around you. So with that, I'll hand over to Jeff McKechnie. Thanks, Jeff.
Thank you, Scott, and good afternoon, everyone. A really good night, the last 24 hours here in Western Region compliance-wise. Just over 20 infringements issued, which is certainly at the bottom of our scale since we started around the 16th of August, collecting those numbers. In Dubbo, less, single figures, which is great. So we just need people to remain focused on the health orders. It's not a time to get complacent. There's some good numbers obviously occurring in different places around the region and some great results and less sick people, which is fantastic. But we still need to remain focused. As the orders change, we need to comply with the new opportunities that Dougal talks about. Again, just apply some common sense, have a read of the order and make sure that you're doing the right thing and not putting you or your family at risk. I have to acknowledge today some communities that have worked really hard around this COVID fight. Ngonia, Brewarrina, Gaduga, all now COVID-free. Fantastic efforts from those communities, small communities who've come together, who've stuck it out, stayed at home, and really got through what potentially could have been, a really disastrous time. And we sadly lost some people from those communities, but they are now, I understand, COVID-free, and we need to work hard with those communities to keep it that way. So we would ask people from areas where there are COVID positive cases at the moment to please don't even consider travelling to those types of locations at present. We've got those towns, those folks are now healthy and free of COVID, and we just need to keep it that way. Burke, no new cases for a few days. Again, fantastic results. If you're from Dubbo, please don't travel to Burke at the moment unless you really, really have to, because it just puts that community and communities like it at further risk of spreading COVID. That's about it from me today. I'm happy to take any questions online.
Thanks, Jeff. If anyone has any questions, could you raise your digital hands now, please? Riley from the Central Western Daily, first up.
Hey there. I was just looking to see if you had available sort of any facts or figures about the amount of PINs for COVID-related breaches issued in Orange and the Western New South Wales as a whole for either like the last month or last week, or just sort of a broader picture, really.
Yeah, I can tell you, Riley, I knew you were going to ask this question. And since the 16th of August, in Western Region, we've issued 3,908 tins. Orange has received 129, and that whole central western area, 338.
Okay, right. And I guess, yeah, can you speak on those a little bit? I know you said the obviously pins are down lately. Do you think that is because people are finally getting the message, or is it might be a case of there are less COVID cases, so presumably less people being linked, so less people who can do the wrong thing and leave their homes when they're self-isolating, I guess.
Well, yeah, look, there's that, mate, but everyone potentially can do the wrong thing if you're living in an area covered by the stay-at-home orders. You don't have to necessarily be suffering from COVID or from one of those houses. So we've seen the bulk of those tins obviously in Dubbo because that's where we have had the most COVID, and many of those pins and tins have been for people breaching the health orders from that illness perspective, where they were actually ill or close contacts. Other areas where we haven't had as much COVID haven't seen that level. The mask wearing is really good. We're not seeing too much of that at all now. It really still is just those odd people who want to flout the rules. Unfortunately, some of them still do have COVID, but they are getting few and far between. And maybe it is because we've been in this now for well over a month, and we've sort of worked our way through a group of people that may have been somewhat recalcitrant, and those messages are finally sinking in, and we're now people are starting to see a bit of light at the end of the tunnel, so to speak, and they are more prepared to abide by those rules. But it could be for any number of reasons. We're just pleased that those tins are down. We don't want to be issuing fines to people during this particularly difficult time. Obviously we will if we have to, but we just want people to stay safe and look after themselves and others.
Cool, brilliant. Cheers for that.
Thanks, Riley. Oliver from the Canberra Times.
Thanks, Matt. My question is sort of linked to what Riley just said there. Was wondering if you might be able to provide any sort of update on the pins that have been handed out in the areas sort of north of Dubbo?
Look, I certainly can for you, but I don't have those with me at the moment, but we can get you the same sort of numbers. But certainly north of Dubbo, there wouldn't have been a lot up that way. As I say, the bulk of them have been around our biggest centres. And if you want to contact Rachel in my office, we'll get those numbers for you.
Fantastic, I'll do that. And my other question sort of revolved around compliance in the areas that have now exited stay-at-home orders or have been out of them for a little while. Was wondering if you have any sort of observations or thoughts on how compliant they have been in those areas.
Look, I think people have been pretty good. We've communicated the message around the fact that if you are in an area where the restrictions are lifted and you enter a location that is still under the stay-at-home orders, then those orders apply to you when you go back to your home or back to that other location. So I think people are very aware of that, and they're being very careful with that. And look, 99.9% of our population are trying to do the right thing all the time, and they're looking after themselves and their families. The number of people we're talking about who breach these orders, in the scheme of things, is quite small.
Awesome, thank you.
Thank you, Oliver. That appears to be it for you, Jeff. Thanks very much for that today.
Thanks, mate.
We'll bring Dougal forward if anyone has any questions for him.
I might just, while waiting for questions, just recognise this could be the final time that Jeff actually joins us at midday. There'll be some more things said about him leaving on Thursday, but I just want to publicly thank Jeff for everything he's done. This is the 42nd day in a row that we've been here. Now, Jeff's been a part of a lot of those with Scott and myself. So, Jeff, mate, thank you for everything you've done. You've been a beacon of hope and a great leader and a great manager of a lot of the emergency operations that have been going on. So I just wanted to say that on what is likely to be your final appearance here today, mate. So well done. Thank you. Good on you. Right, any questions?
Thanks, Dougal. Gary from ABC.
Thanks, Matt. Hi, Dougal. Just a question in regards to the 70 and 80% milestone targets. Is that a state average? So I guess to say once the state as in general reaches 70 or 80%, we'll see those increased freedoms, or does each individual local government area need to reach 70% before we see those freedoms?
Yeah, no, look, it's a general average across the state, and there will be some areas, and I guess that's why Scott's particularly pointing out again today that we can't relax and think, well, because on paper everything looks quite good, particularly around our first doses, but it's all about the second dose. So it is a state average, but we don't want areas to get left behind. And I know there'll be councils that are really encouraging their residents to come forward and make sure they get a second jab as well. It looks like the state as a whole, on average, is in fact ahead of where we thought we'd be again. So we're really hoping that in the next 3 or so weeks we'll be at 70%, and it won't be long after that we'll be at 80%. But I think what you're pointing out is there might be some parts that aren't quite there yet, and we really want to make sure we're bringing those parts along for the ride right now, so that everyone is aware that you need to get your first. If you haven't got your first, you need to do it now. And your second, you absolutely have to make sure you get that, and you actively look for it. If you haven't been part of one of the ADF clinics, or you've missed out for some reason, you really actively need to seek out your second one to be part of our region getting out of this as a whole.
Great, thank you.
Thanks, Gary. Riley from Central Western Daily.
Hey there. So my question just relates around the new child bubble rules. I just wanted to clarify. Obviously, both you said parents need to be fully vaccinated between the households. I guess with cases where children are moving between homes for caring responsibilities, so children of divorce, do both parents in that situation need to be fully vaccinated, or would it be a situation where if the kid's staying with one parent who is fully vaccinated, they can go see their friends during that time? Or when they see their other parent who might not be, they can't? Or is it just a flat no, they won't be able to see the friends?
Yeah, look, that's a good question. I mean, obviously the care and responsibility of children from separated parents is a difficult one, and we've had a lot of people asking about the best way to manage that. In this particular case, I guess it will be probably, if you're spending time with both mum and dad, or whatever the parents might be, is that all of them will need to be double vaccinated for it to work in essence. And I think that will therefore need to be some decision making from the parents of the child to decide how they're going to make that work. So if your child is desperate to be seeing some friends and only one parent is double vaccinated and the other one shares custody, there's going to have to be, I think, a fairly strong discussion around how that's going to work. Look, there's no absolute rule on that as far as I'm aware at the moment, Riley, but the suggestion is that really, because all of the children can't be vaccinated at the moment, although anyone over 18 in this circumstance needs to be, we have to, as parents, as the adults, we all do need to be double vaccinated to make sure that, we're protecting the children as much as possible. So I think probably the answer is yes, all parents, whether they're split or not, will have to be vaccinated to take part in that bubble.
Okay, cheers for that.
Thanks, Riley. Joanna from ABC Central West.
Hi, Mr. Saunders. Your Nationals colleague Sam Farrell has put on social media today that 4 towns in our region will be considered for getting out of lockdown, a decision on Thursday. So Orange, Gill, Narromine and Bray. Do you know what criteria these towns have achieved or reached or not, as the case may be, in order for that to be now considered in a decision on Thursday?
Yeah, so I mentioned that earlier on, Joanna, but the criteria basically is a bit of a discussion that's done with health at a local level. So Scott and I have certainly talked about these areas. That is then put forward to the expert panel that considers them, and then through the Deputy Premier and the Health Minister and the Chief Health Medical Officer, the decisions are made. So essentially, for these 4 areas, Orange being one of them, Gilgandra, Narromine and also Brewarrina, it's around that risk of any cases that have happened, and there haven't been any for roughly 14 days for every single location, and around the community infection around that scenario as well. So Health looks at that. Health does all of the work around what they think the risks might be. Now look, that could change overnight. We've seen again today another case in the Mid-Western Regional Council area. We've seen a case at Cowra from a couple of days ago that popped up out of nowhere. So things can change very quickly, but it is an expert panel with some feedback from a local level, and Scott and I have certainly discussed that, and hopefully those LGAs will all have the opportunity tomorrow to come out, and that announcement will be either late tomorrow afternoon or Thursday morning.
Thanks, Joanna. That appears to be it for you today, Dougal. Thank you very much. We'll bring Scott forward now, and we will kick off with Ollie from Wynn.
Hey, Scott, how you doing?
Hey, Ollie.
I was just hoping to see if you had any extra details on the new case in Cowra today. You know, are they connected to yesterday's case? Was the child at the school premises while infectious or anything like that?
Sure. So we don't have known links to the new case in Cowra at the moment. So we're concerned that we're still trying to track down where the original case may have come from. We've got some suspicions that it may be a part of the school in Cowra, that this was a parent of a child that goes to the school. And so we're still doing a lot of tracing and tracking down. That the testing numbers in the last couple of days have been really high at Cowra, and so that's really pleasing to see. So hopefully in the next couple of days we can identify if there are further cases in the community that are infectious, and we'll pick those up.
Brilliant. I really appreciate that. Thanks.
Thanks, Ollie. Talia from the Nyngan Weekly.
Hi, Scott. Just a quick one. I'm not sure how much you'll be able to help me. There's a bit of concern around town that we obviously haven't had a case in over a fortnight, but we continue to have positive sewage testing. Is there any chance that even without a case that the Bogan Shire might put back into lockdown if we continue to have these positive sewage tests?
Well, I think the sewage tests are a pretty good measure that there's been or is someone infectious in the community with COVID, and so I really would love to see more people come forward to get tested in Nyngan. The testing numbers since we made available the surveillance testing, where people don't have to isolate if they don't have symptoms or are a part of a household that someone has symptoms, haven't actually risen that much in Nyngan. And so can I please encourage everyone, come forward and get tested in Nyngan. If you've got any signs and symptoms, don't leave the house without coming forward and get tested. But equally, come and get tested if you don't have symptoms and you don't need to isolate in those circumstances. Now, those sewage tests are now part of the consideration around whether a community or LGA is under stay-at-home orders, along with the testing numbers and when the last infectious case was in the community. There's an expert panel at the statewide level that's taking all of these things into account. The surveillance pieces are really critical in this, and importantly the sewage testing. That the rates aren't always a perfect measure of whether someone's infectious, and so there's a lot of consideration being taken into that.
Thank you so much.
Thanks, Talia. Andrew Fisher from ACM.
Thanks, Matt. Scott, I've got a question. You may have answered this before because I haven't been on all of these calls, but it's just around the possible pressure on the health system when the state does open back up. Could you just give me a brief outline of any planning that's already taken place to ensure the nurses and other health professionals receive the support they need when we do open back up?
Yeah, sure, Andrew. So we've got a network of 38 hospitals across the region, and a big network of statewide hospitals as well that are well prepared for if we have further cases emerge again in Western New South Wales. Forecasting at the moment tells us that at our current number of cases, we've got more capacity than we need for all of the care of patients with COVID. Now, one of the real successes in Western New South Wales has been our COVID Care in the Community program that's now cared for over 800 people in their homes without needing to come to hospital, and it's a program and a level of care that I think we've now set a new national standard around how we can help people keep well and healthy as well as can be with COVID. And so that's been a great tool in our arsenal of helping to reduce the numbers of people needing to come to hospital. What we've also seen is people that have needed to come to hospital for 24 or 48 hours that might need some help with some oxygen therapy because their oxygen saturations are low, or other ongoing health issues that might just need some clinical care, some medications or other support in a hospital. And a small number of people that have needed admission to intensive care, and that number's been lower than what the state has actually seen. And so we've done a lot of the forecasting and thinking around whether we do have the capacity, and I'm sure we do, for forward months to care for patients right across those three settings: in the community, in home, in hospital general beds, or in intensive care. We've done a lot of work with our staff to make sure that they're all skilled, they're ready to care for patients with COVID, but on any day of the week we care for 5 times more patients with other chronic and ongoing health issues, and that's a lot of the role for our hospitals that we'll continue to provide.
Okay, thanks, Scott.
Thanks, Andrew. Joanna from ABC Central West.
Thank you. Just back on the Cowra cases, Mr. McLaughlin, is there any consideration given or any chance that they could be linked to the Hilltops cluster, given its geography proximity?
Yes, our statewide public health network are doing the tracking and tracing to see if there is any links between Cowra, Young and the surrounding communities. And so we'll continue that work. We don't have that definite lockdown yet. As I said, the new case overnight that's been identified in Cowra, we don't have known links. And so can I encourage everyone in the Cowra community, please come forward and get tested. If you've got symptoms, don't leave your house without coming forward and get tested. And please, if you don't have symptoms, today's the day. Come and get tested at the showground. That's readily available right through till 3 p.m. this afternoon.
Thank you. My second question, with regards to the consideration of the 4 towns coming out of lockdown, given that you have said that you're concerned about the low testing numbers in Orange, do you support that consideration that it could be released from lockdown in a few days if so few people are getting tested?
Well, we'd love to see more people getting tested right across the region. Over around 3,000 people in the last 24 hours got tested. I'd love to see that double that rate. That helps us have a lot more surveillance out in the community to understand if COVID is not being detected or diagnosed. And so, for people in Orange, please come and get tested. Tomorrow sees the start of the surveillance testing. That means you don't have to isolate if you don't have symptoms and you're not in a household with anyone with symptoms. So please, there's a great opportunity there. Please, in Orange, come forward and get tested. I think the considerations around the lockdown or stay-at-home orders are getting better every day of the week. The panel that is now looking at that has taken into account all of the things in Orange and the other communities across the region, and I'm sure we'll hear more on that in the next 24, 48 hours.
Thank you.
Thanks, Joanna. Riley from the Central Western Daily.
Hey, I know you aren't sort of part of the decision-making process about the lockdowns, but I guess can you speak generally about why the 14-day period with no cases in the community is of such importance? Like, why is that the particular number? And kind of explain that to the community.
Yeah, sure. So across the period of a person's infection with COVID, we know that around 14 days is where the vast majority of people both aren't infectious and have recovered from their illness. Now, some people it takes a bit longer, but that's become the hallmark of 14 days is the best measure of a person coming out of their infectious period or really struggling with their illness. So that's the best measure we've got at the moment. We'll continue to refine that. It's different for different age groups as well. We know that some people become much more infectious than other age groups, and particularly in younger kids, that they're not as infectious as older generations. Now, those things will continue to be refined, I'm sure, but 14 days is the best measure we've got at the moment.
Cool. Yeah, that's all from me. Thanks.
Oliver from the Coonamble Times.
Thank you. My question surrounds the vaccination numbers. Earlier you talked about quite a few towns that have been doing really well, hitting that 80, even 90% mark. Was wondering if you might be able to provide a bit of an update for the Coonamble Shire.
Sure. So we don't have the data through yet for Coonamble, Cobar, Burke, Brewarrina and Walgett. That should be coming through hopefully later on this afternoon. So we'll provide those when they're available. We know that there's been a lot of vaccination in those regions. I know Coonamble last week was the highest in the region, and so I'd expect to see that continue. What we do know, though, is there's still a long way to go with the second dose vaccination rates. And so whether you're 80, 90% with first dose, the big challenge for us is to get second doses in the arms of everyone wherever possible. So please don't hesitate to come forward and get your second dose. Start planning it and start making sure that you've got bookings to do that.
Fantastic. That's all from me today.
Thanks, Oliver. Finally, Gary from ABC Western Plains.
Thank you. Scott, why are second doses so low? Like, why are you having a lot of trouble getting second jabs in arms?
No, Gary, we know we've seen a huge number of people vaccinated in the last 3 and 4 weeks with the ADF clinics, the local health districts, the GPs, the Aboriginal Medical Services, the pharmacies that have all had a big influx of vaccination supply in the last 3 to 4 weeks. So I think that's really got us up to a good place with people getting the first doses. This is turning our focus now to making sure that people get the second doses in their arms as quickly as possible. Now, we do have some LGAs that have got reasonably good rates of second doses. So a couple of call-outs here, Forbes with 56% the second dose and Warren with 62%. So there's certainly been some communities that have stepped up and don't have as far to go as others, but we do have some communities down around high 30s and low 40% rates of second dose in the region. We'll provide further details on those later in the day, mate.
And the Central North Police District on social media earlier today said that the confirmed Walgett case today isn't actually in Walgett, and I assume they just have a Walgett address, but they weren't in the community while infectious. Can you confirm if that was the case?
Awesome. We're still doing our contact tracing, so we'll come back and confirm the details of that case once we've got more definite information.
Okay, great. Thank you.
Thanks, Gary. That's everyone, so we'll call it a day there. We'll get the recordings out as soon as we can. Thanks very much for attending.
Thanks, everyone.
Thank you.
Thanks.